I would recommend making sure this checklist that we're going to go over is completed about 6 months to 4 months prior to starting to conceive. Of course, many of you will be dealing already with infertility, so this list might include some parameters specific to your situation. So the things to do: a PCP visit, your primary care doctor, a well woman exam, quit the birth control pill if you're on it.
That's key.
You just can't get pregnant if you're on the pill because it's an extremely effective form of pregnancy prevention. And visit your dentist. So now let's go over those in a little bit more detail.
Yeah, that sounds helpful.
Yeah. So if you haven't seen a PCP in the last year, a primary care provider, then see them now during this preconception phase. And if you don't have care established with a primary care provider, this is the time to do that. During that visit, you'll want to confirm that all the prescription medications that you're on are safe for pregnancy. And if they aren't, make a plan with your prescribing doctor to modify that prescription to be safe for pregnancy. In licensed states such as Oregon, where I live, this can be your ND doing your primary care visit. You also want to make sure that you're addressing any anemia or thyroid problems here. And you can ask your PCP, if they don't already do it, to run all routine blood work to check the basics. And they'll check your blood pressure, check your weight, and kind of get a good baseline. So that's step 1 in the preconception phase.
Right. So far, I am totally on board.
Okay, awesome, good. My second is to get your well woman exam. Your primary care provider, unless they are specifically doing your well woman exam, is not the person to see for that. So if you haven't seen your OB-GYN or midwife in the past year, I recommend seeing them now for your well woman exam during this preconception phase. You might need a pap smear, a pelvic exam, or some other blood work, depending on what's going on, and they're more likely to run hormone-specific blood work or blood work that may be related to menstrual disorders that you're reporting.